Hi there, Dr. Craig here. These are what we call the spinal hygiene exercises. They're an integral part of your chiropractic care. And the reason why is because what they're going to do is, now that we're getting your spine moving through the corrective adjustments, we're going to start to train your body and your spine to start to move properly. In order to do that, we have to visualize in our minds while we're doing this. If you think of your spine as 24 movable bones, we want to start to try to move the first bone first, then the second bone, then the third bone in a slow, deliberate manner. So think of doing the first ones is what we would call the flexion exercise. So simply just taking that top bone in your neck and moving it as far as it'll go, then the second one, then the third one, then the fourth one, then the fifth, sixth, seventh, and so on. As you start to slide your hands down the front of your body, you're just moving in a slow manner, trying to move each segment individually as far as it'll go. Each one of these exercises should take you about 30 seconds to complete. So as we get down to the very bottom, I'm going to start and do a rewind. So I'm going to go all the way back up, one segment at a time. Sliding all the way back up to a start position. And then I'm going to go into an extension position. So I'm going to take my head back as far as I can. I'm going to go into my upper back. I'm going to lean back. As far as I can. Obviously, you're not going to go back as far as you went forward, so just be aware of that. But the next one we're going to do is the rotation. So starting with your nose, hands out in front of you. You're just going to take your nose as far as you can, moving the third, fourth, fifth, sixth. And then you're going to start to feel the pull coming into your upper back as you start to continue to turn your nose. You're going to feel that go into your lower part of your rib cage, into the upper part of your low back, finally into your low lumbar spine. You'll notice that my hips are staying straight. I don't want to turn and twist them. I want to keep them as straight as possible while I'm doing this. I'm going to go all the way back with my shoulders and my head coming back to the start position. Then we're going to go the other way. So I'm going to turn my head as far as I can, then my shoulders, then my mid back, into my low back, and then I'm going to pull back to the start position. Okay? Finally, we're going to do the side bending. So we're going to take the top bone, then the second, then the third, so on and so on. Just sliding your left hand down the outside of your left leg as you go. We're going to come all the way back up nice and slow, moving each segment at a time into the other side. We're going to go as far as we can, and then we're going to come back up. Okay, so if you've been driving for a period of time, you've been sitting at your desk, whatever the case, these are going to help to get your spine moving in a healthy manner. So these are great to do even before you're going to do some gardening or play hockey or whatever you intend to do physically. They don't replace your adjustments in any way, but what they do is they help to get strength and integrity back into the whole system and train it to move the way it's supposed to, okay? The next one we're going to do really works on the position of your head and your shoulders. We live in a very flexion-focused world, so as our shoulders come forward and our heads come forward, we get into this very slouched posture. We're going to start to change that by strengthening our bodies and our shoulders and our head position into a much more upright position. So all you need is a flat wall. And for this one, I'm going to preface this by saying 95% of people can't do these starting off. So be patient with yourself. If you find, the first thing we want to do is we want to keep our heels, our buttocks, our shoulders, our head, our elbows, and our wrists all against the wall the whole time. While you're doing that, you want to try to slide up. If you can't even get your shoulders back or your elbows back, this is where you start, and this is all you're going to do. I just want you to get the elbows back, and if you still can't get the wrist back, you're just going to start there and try to hold it back as far as you can for your 30 seconds. If you can get your wrist back and you can keep your head back and your shoulder back and your heels against the wall, we're just simply going to start to slide everything up against the wall. The minute you feel your wrists or the backs of your hands or anything lift away from the wall, stop and just hold that for 30 seconds. If you're able to keep everything against the wall and you can start to slide all the way up to the very, very, very top, keeping everything engaged, terrific. That's what we want to see eventually, okay? So you're going to hold that at the top, the highest position for 30 seconds that you possibly can. In the second one, what I'm doing is my feet are slightly away from the wall. I'm going to arch my back in that start position. I'm going to let my breath all the way out, and I'm going to flatten my back up against the wall. So again, feet just a short distance away from the wall. I'm going to arch my back. I've got everything against the wall. I arch my back, let my breath out, flatten the back against the wall, and then raise your arms above your head as high as you can. Okay? The whole time I'm trying to press my low back against the wall. So if somebody was standing here holding their hand against between my back and the wall, they would feel that my low back is pressing into the wall. This one is very, very tough. So if you have to start there and just push your low back into the wall and keep that, feeling your core naturally engage while you start to engage your arms, stay in that position for 30 seconds until you can hold that while raising your arms up. That's your cue to start progressing, okay? So these are the spinal hygiene exercises. I know that they are going to help you. They are to be done daily. If you have any questions on them whatsoever, just ask myself or my team. Thanks a lot.